So today I'm going to talk a little bit about something that's very interesting that we learn about patients. You know, I sometimes read the comments online about our videos and what we do, and a lot of the time people say only rich people get this done. And I want to sort of reframe that to only people that find a good dentist can have this done. You know, because in the 20 years that I've been practicing, I've treated people on all socioeconomic, you know, from people that are unemployed, on disability, retired, working, everything. And I have learned that, you know, having bad teeth or getting bad dentistry that leads you to have full arch implants is not specific to any socioeconomic class. And I could probably say that people that are not quote-unquote rich probably see better dentists. Because, you know, when you choose a dentist to have this done, and these are things that it's very important that our patients understand, is that they should never look at what's the cheapest, you know, because if they looked at what's the cheapest, what quote-unquote their insurance covers, which we all know insurance doesn't cover this type of dentistry, because this is dentistry that's going to keep them healthy, and insurance company is not going to make money on that. But rather dentistry that they actually need. You know, if they just, most of the time the people that are in this situation that need our work is because they went to a dentist and that took their insurance and they did one crown here, one crown there, one crown there. And that doesn't matter whether you have a great job or you don't have a great job, you have dental insurance and you just get that $1,500 a year, which is basically 2 cleanings and a filling, or maybe 1 cleaning and a crown. You know, and that's not what comprehensive dentistry is needed. So in reality, when you choose a dentist, it doesn't matter the socioeconomic class, but more importantly, how do you make sure that you choose a dentist so that you don't end up in the position that you need to have this full arch work. And now, when you do need this full arch work, you better not make the same mistake, because I constantly see patients, it's almost like they forgot what got them here, you know? Like, you call my office and say, what does my insurance cover? Well, you're calling me obviously because you need full mouth rehab, right? Your teeth are broken, you're missing teeth, and you've been calling your dentist and choosing your dentist based on what your insurance covers, and look where it got you. So the mindset sort of has to change, and the question should be, is this doctor an expert in implant dentistry? Is this doctor an expert in full mouth rehab? Is this a doctor an expert, does he do this every single day? As opposed to, does my insurance cover it? Because at the end of the day, I promise you, if you ask a patient and say, listen, I'm gonna do dentistry on you, and the insurance is gonna cover it, but in a year the whole thing is gonna fall apart. You're gonna be missing your front tooth, you're gonna be in severe pain, you're gonna have huge infection. Do you still wanna do what your insurance covers? And obviously if they say yes, they probably still don't understand the severity of it, because I can tell you, when you're a patient that has pain, you're a patient that's missing your front tooth, you don't care what it costs. You're gonna make sure that you get it done correctly. So what I tell patients all the time, doesn't matter your insurance. What matters is the expertise of the doctor. And make sure that if your doctor is bringing you back 30 times to fix one tooth, right? And your doctor never gets it right, and everything needs to always be redone, you should probably look for another doctor. And it doesn't mean if you take insurance or you don't take insurance. But in reality, what it is that you need to choose someone that does this every single day. And if they do root canals every day, go to them for every day. If they do only cleanings every day, go to them for cleanings. If they do 1 crown a day and they're experts at doing 1 crown a day, go to them. If you need full mouth, specified, highly sensitive, highly technique needed, highly skill needed to have full mouth of implants and bone grafting and tissue grafting and extractions and temporaries and design of your smile and design of your bite and all of this stuff, you're not choosing the guy on your insurance. Let's be honest. Choose the person that's going to get you healthy, where, like my patient said to me, once I had my teeth fixed with you, I really didn't need to go to the dentist.
Look at that. Wow.
And that's really the goal that you want. You don't want to have to see me every day. You want someone like me to fix you, and then just see the hygienist, because she's way more pleasant than I am.